So good afternoon, everybody. Welcome to this afternoon's Angus IJB. Lovely sunny Angus day. Well, it is sunny with me anyway. I hope it is wherever you are as well. I hope everybody's well. I know even though COVID restrictions have now relaxed across Scotland, I think it's important to acknowledge the pressures and challenges that still remain for our HSCP colleagues and those in the third sector and independent care sector, and as usual to thank them for their continued efforts. As we are in the pre-election period for the local authority elections, I do need to read out the following statement, if that's okay. So as members are aware, we're currently in the pre-election period in light of the forthcoming Scottish local government elections on the 5th of May 2022. With reference to Angus Council's pre-election guidance, Section 5 of the guidance covers publicity, which includes online partnership meetings, which are webcast or subsequently published. We need as members to be aware of the legal requirement not to publish anything which appears to be designed to affect political support for a political party. The legislation makes it clear that the timing and circumstances of publicity is a key factor in deciding if it is politically partial, which is why there is greater sensitivity during the pre-election period. The key test is whether a particular act can be perceived as seeking to influence public opinion or to promote the public image of a particular candidate or group of candidates, whether or not they are existing members. A common sense approach is required, and I would remind members simply to be mindful of this in their discussion and debate today. Okay. So I wanted at this point just to sort of welcome formally Eunice Mclennan, who's now taken up her post with Angus HSCP. So welcome to Eunice. This will be the last meeting for Vivian Davidson, and would like to thank Vivian for all of her hard work for the Angus HSCP, and particularly latterly for all her work on the revision of the 3 integration schemes, which there's been a huge amount of work involved in that, as everyone is aware. So thank you very much, Vivian, and all the very best to you. This is also the last meeting for our Vice Chair, Councillor Bob Miles, who won't be standing as a candidate in the forthcoming elections. So Bob has been a member of Angus IJB since October 2018, around the same time as me, and he took up the role as Vice Chair from June last year, June 2021. So anybody who knows Bob knows his dedication to Angus and to the people of Angus. During his time as a member of the IJB has been through some very challenging times, including, of course, the recent COVID pandemic, and we've had to make some difficult decisions. Bob has provided really valuable contributions to this throughout the past 4 years, and has really helped to keep the people of Angus at the heart of all that we do. I'm very grateful to Bob for all of his support as Vice Chair. On behalf of the IJB, I'd like to thank you very much for all that you've done and to wish you all the very best for the future as well. So thank you, Bob.
Thank you very much for your kind words, Emma.
No problem. And just to say that today we will be taking a short break. We'll see how timings go for the meeting, but just to let you know, we will take a short comfort break. So we now move into the agenda proper. Item 1 is the apologies. Karen, have we got any apologies?
Apologies from Dr. Emma Fletcher, and Barbara Tucker has intimated it should be later in the meeting. Thanks, Chair.
Okay, thank you. And moving to item 2, which is declarations of interest. Have we got any declarations of interest? No. Okay, thank you. Moving to item 3, which 3A is the minutes of the meeting on the 23rd of February. Thanks, as always, to Karen for these minutes. You'll have all had a chance to look through them. Are we happy to approve those as a correct record of that meeting? Yep. So I see a couple of hands up. Sarah?
Thank you very much, Chair. No corrections in terms of the body of the meeting note. It's just in respect to noting a change in my job title to Nurse Director from Associate Nurse Director, just for the purposes of the attendance list and meeting notes. Thank you.
Thanks, Sarah, and we'll make that change to the minute. And I see another hand up. I can't actually see who it is. If you want to turn your camera on, if you've got your hand up.
It is me, representative for Angus Council. Just a couple of things. If I can come to the minute in a proverbial minute, if that's okay. My first point in regarding to the minutes of the last meeting, I wasn't sure where to put this, but I really just wanted to register my own concerns at the length of the last meeting and the fact that the two green papers, item numbers 18 and 19, were at the end of a very, very long and extensive agenda. Items 18 and 19 were green papers. They were significantly, well, all papers are important, of course, but the gravity and the effect and the outcomes of the decisions that the Integrated Joint Board was going to make on the basis of those two green papers were huge. And for them to be sitting at the end of an already long agenda, I feel put members under pressure of time. And it was also, it felt very, very hurried towards the end of the meeting, and understandably so. It was 6 o'clock by that time. So what I really wanted to ask was that due consideration is given in the future when there's items of such importance, or even agendas that are somewhat lengthy and long, that we can be mindful of the impact of the decisions of those green papers, and that we give the appropriate time to address the contents of those papers and allow members sufficient time to draw their conclusions and vote accordingly. It felt very, very rushed. I understand the pressures of time, but I would really ask that in future that we can perhaps schedule. There were meant to be special meetings for one of those papers at least, and if that can be referred to in the future as a way of dealing with matters of such gravity. So I really just want to share my concerns. I'm aware that's probably not the right place for that to be, but I wasn't sure where else I could raise that through the format of the meeting today. My other points were in regard to the minutes themselves, and not necessarily on accuracy and quality, because Karen always does a brilliantly sterling job. But I've just got a couple of queries and questions on some of the wording on them. On agenda item 18, it said that following discussions where a number of members raised concerns and questions. There's no detail onto what those concerns and questions actually were. And I suppose, and in addition to that, the minute advised us that George Bowie had given an informative update, but it didn't give any detail on what that update was actually of and about its content. As staff side rep for workers employed by Angus Council, working for the Health and Social Care Partnership, it's really important for me in my job to be seen that I'm echoing and reflecting the interests of the workforce employed by Angus Council. So certainly on item number 18, there's no reference that I had said anything other than I was grouped in with a number of members, and I'm wondering whether we can look at having that corrected. And I suppose ditto also for item 19 as well. You know, I don't sound selfish about this, but I spoke at reasonable length in support of the amendment that had been put forward, with a number of reasons why we felt, or I felt as the staff side representative for the council, that different decisions should be considered to the one that was ultimately made by the Integrated Joint Board. And again, there's no detail about what I said, and I don't, obviously we're not reopening an old debate here by any stretch, but I was somewhat concerned and interested as to the reasons why, the background, that the statement that I'd given in support of the amendment wasn't given any more detail, so that those reading the minute subsequently were able to see the input that I and others and indeed made to the whole discussion around agenda item 19 and the subsequent amendment. So apologies for talking a little at length there. I just need to put those points over. Thank you.
Okay, thanks for that, Chris. On your initial point noted, I think that meeting, it was a lengthy meeting. It went on longer than anyone, and your point will be taken with regard to adding items such as that was already a fairly lengthy agenda. I see Karen and is it the Gail's hand up as well, and they perhaps want to respond with regard to the content of that minute. Karen?
Thank you, Chair. Thank you, Chris, for your comments. It was really just to provide a tiny little bit of clarity in terms of the exempt information. And basically, you know, going back to the minute of the 23rd of February, I were exempt in nature, as was the discussion. So therefore, the minute cannot reflect anything that would disclose any exempt information to the public. I know that obviously that is very vague and it's not possibly the response that you're expecting, but disclosing information if I was to provide that in more detail, which we're not permitted to do. So I hope that answers some of the questions that's been raised.
Thanks for that, Karen. I think that's helpful. Gail?
Yes, it was actually the former part, Chris. Thank you for your comments. Likewise, the Chair and Vice Chair and myself also thought the length of the meeting went on. So that's definitely a learning point for us, and hopefully we've reflected on that, and the agenda today reflects that. But you're absolutely right, where we have exempt papers, we need to consider that, and whether we have a special separate IJB meeting to avoid increasing the length of the meeting. So thank you, Chris, for raising that.
Thanks, Gail. And Councillor Speed?
Yeah, thanks, Emma Jane. Yeah, I fully support and agree with all the comments and concerns that Chris has raised, but I note the responses back. My query was with regards to agenda item 19. And I think it's probably already been answered, but I did want to seek clarification on how my amendment didn't actually go into detail of what the amendment was.
Through yourself, do you want me to respond?
Yes, you respond, Karen.
Thanks, Councillor Speed, for your question. Going back to the response I provided earlier to members, it was really just the same situation as if I was to provide the detail of the amendment in terms of the recommendations that were brought forward, I would be disclosing information that's exempt, not just in terms of your recommendations that you've provided, but in terms of the report itself. So that information could not be provided in the minute.
Okay, thank you.
And Councillor Bell?
Thank you, Chair. I just wonder, I mean, fully take on board Karen's points and understand them, but I wonder if it would be possible for the minute to reflect that Chris spoke in support of the amendment and leave it at that, so that at least there's a recognition of the contribution.
Would that be possible, Karen?
Sorry. Yes, sorry, Chair. Sorry, I thought it was still on mute. Yes, I can.
Okay. Thanks for that suggestion, Councillor Bell. Any other comments on the minute? No. Bob? Sorry, Councillor Miles?
Yeah, no, Bob will do fine, Jane. It's not really on the minute, but just subsequent to that, I didn't know whether to raise it now or an action point. Have we heard anything from the NHS about the letter you sent about the Mulberry unit at Scathro? Has there been any response as of yet or any recognition?
Gail, do you want to take that one?
The Chair's actually off at the moment. Bob, the letter went to the Chair, and my understanding is it's been redirected to the Chief Executive.
Okay, thanks.
Okay, thanks for that. So subject to that change that we've discussed with regard to the, I think it was agenda item 18 or 19 with regard to Chris's input, are we happy to approve this as a true record?
Yes.
Yep.
Yeah.
Okay, thanks very much. And we'll move on now to item 3B, which is the action points update. I'll pass over to Gail for this. It looks like a good picture, I have to say, in terms of those items that are complete or on track. But Gail, you can maybe provide a little more information on the two red items at the end.
Yes, thank you, Chair, for that. You're absolutely right. This is indeed an improving and a positive report. 4 of the items on page 17 and 18 will now move to complete as well, because 4 of them are on the agenda today. With regard to the 2 red items, that's on page 19, dated the 14th of December 2020. Item 2, it says there about the mental health and wellbeing strategy. I can confirm that work has started to progress this. It's been identified and it will be highlighted in a report later on the agenda today regarding mental health. But the plans will be expected to provide a description, particularly relating to the financial resources, the commitments, and the high level of further information and investment priorities will be identified there to deliver on the mental health and wellbeing strategy. We've amended the date to now say August 22, 2022, so I would hope that that's realistic now. The other agenda item has also, that's been a slippage due to COVID, as you're all aware, and we've also agreed a further date to be October 22, and I think that again is a much more realistic date as well. So yes, I'm very proud of the team, Emma Jane, for progressing this. It's a good news story.
That's great. Thanks very much, Gail. Do we comments on that action log? No, and we're happy to note that then. Thank you. And we'll move on to 3C now, which again is a minute, and this is of the special meeting of the IGB, which took place on the 2nd of February. You'll all had a chance to look through that one as well. Any questions or comments on this one? No, so we're happy to approve that as a true record of that meeting. Yep. Thank you very much. Okay, we'll move on now to agenda item 4, which is the ethical standards in public life, the code of conduct. Is this Lewis we have for this one? Or
yes.
Gail?
Yes. Good, Lewis.
Yes, Lewis present, yes.
I'm happy to speak to it, Gail, if you're okay with that. So by way of background, the Standards Commissioner for Scotland has issued a new code of conduct for devolved bodies, and this has to be implemented by the Angus IGB by the 10th of June. The key change is that it emphasises it's the members' personal responsibility to be familiar and comply with the provisions of the code and the rules relating to that. A key point is it provides that members will not at any time advocate or encourage any action that is contrary to the code. And I would say that it's our intention to deliver training to members on the changes there within. So the proposal is that any reference to model code within the current standing orders shall mean the Standards in Public Life Model Code of Conduct for Members of Devolved Bodies 2021.
Okay, that's great. Thanks very much, Lewis. Do we have any questions on that? Councillor Miles.
Yes, Chair, it's not really a question, it's just a comment. Having been on the council for 23 years, I'm quite familiar with most of what's here, and it's all pretty common sense. The thing I would like to highlight is 3.7, and it's a very difficult one to kind of ride a dividing line here, where you have to take your role on board seriously, but not become involved in operational matters. There are certain, and I'll not name who they are, certain especially political members who try and interfere in the operational matters, or have done in the past. And that it's drawing a dividing line between what you do as a board member and your role as a board member, but without interfering in operational matters. So it's a thin dividing line that sometimes some find it difficult to comply with, but if it's highlighted in the training, that'll be a good thing.
Okay, thanks for that. Moving on, Sarah Dickey.
Thank you, Chair, and thank you, Lewis, for your explanation. I'm thoughtful, having read the code and been advised around paragraph 3.10, and wondering that as a member of this board, we make matters of collective responsibility as opposed to an independent chair. I'm just wondering how relevant that section is and whether or not we opt out or in. I understand there's been some conversations at the Scottish Government in regard to that paragraph.
What I would say to that is we would have to adopt the code in its entirety, but if there's a subsequent revision made to the code, then we wouldn't need to come back and approve that, because they would just amend the 2021 code. So there's not really much we can do about that. We can't adopt it excluding 3.10.
Apologies, that wasn't my understanding, Lewis. I've understood from Scottish Government as that an IJB can opt out of a paragraph when adopting the version of the code.
Yeah, I spoke to the Standards Commissioner about this actually, because there are other parts of it that I looked at. Their advice is that we have to do it in its entirety, but I can follow that up if you know, if you don't think that's right.
I think it would be important to cover in the training or the briefings that you're referring to thereafter, please, Lewis. Thank you.
Okay, thanks for that, Sarah. And Peter Drury.
Thank you, Emma Jane. I want to wholeheartedly embrace writing reports in plain English, which is a reference under 3. This report was easy to read, it was very clear, and I'd like to make a plea for more reports, including all of our papers at the IJB, to be written in a clearer English.
Okay, thank you for that, Peter. I agree with you in terms of the way this is written. I think it is very clear and good to see. Councillor Speed.
Yeah, thank you, Emma Jane. I just wondered if Councillor Miles could maybe just expand on his comments and just give some examples, which would be helpful for my own understanding.
No, it was just as a board member, you're not become involved in operational matters, and it's finding the dividing line between what is operational and what is not operational. We often set the strategic direction, but we don't get involved in operational matters. And this is the difficulty that some members have, is finding that dividing line between what is operational and what is strategic. And again, it's through either discussion with both the Chief Executive or others to get that division between what is operational and what is not.
Thanks for that, Councillor Miles. And I think Bob was highlighting the importance of that element.
Sorry, Emma Jane, I was just going to follow up and come back. Yeah, I mean, I think it can often be a bit of a challenge because, you know, we are here as board members. And so that's one hat that we wear, but then we also are councillors and are here to represent and advocate on behalf of our constituents as well. So yeah, sometimes I guess some of our correspondence and some of our dialogue and engagement with health and social care partnership officers will be at times coming from 2 different places within 2 different roles.
That's a difficulty we have, Lewis, and wearing 2 or 3 different hats. I've always had that difficulty, but it's being able to find the dividing line and to treat everything with the respect and courtesy that everything deserves to get there. So it's a thing that should hopefully will be covered in the training.
Okay, thank you very much for that. Do we have any other questions or comments on this before we move to the recommendation within the paper? No. So the recommendation as provided is that we adopt the model code of conduct Are we all happy as an IJB to do that? Yep. Okay, thank you very much. And I think just noting Sarah's earlier point in terms of whenever we receive the training or further information, Lewis, it would be useful for us to cover that element that Sarah had pointed out as well. Okay, thank you very much for that. So moving on to item 5 in the agenda. Sorry, I'm just flicking through my papers. Here we are. Okay, so just before we go on to item 5, which is on the revision of the integration scheme. So as members will be aware, the addendum to this report number 24-22 hasn't been published in line with the IJB's standing orders. However, as chair of this meeting, I determined that the information provided by the Chief Finance Officer, which was issued in an email earlier today, will be considered as part of the report today. It was emailed through earlier on. I hope everybody had an opportunity to have a look at that. I'm very happy to have a 5-minute adjournment to allow anybody who hasn't had the opportunity to read that to do so. If you'd like to raise your hand, if you haven't had the opportunity to read that information that Sandy had sent through. No, so I will take that everybody's had the opportunity to read that information. And we will just continue on with this agenda. So thanks very much for this paper. I think, again, just to echo what I said to the start, what I said at the start in terms of Vivian's work around all of this, huge piece of work, and thank you very much to her. Gail, who's going to take us through the paper?
I can start. Can anybody tell me if Vivian's in the meeting? Just so as I know how much detail to provide.
Yes, I am, Gail.
Oh, that's good. Thank you, Vivian. I'll introduce that and hand over to yourself. I was just thinking, oh gosh, I'm going to have to go and get some water here. As you all know, the integration, the review of integration has been required as per statute previously, and work has progressed on delivering these revisions as identified as part of this review. Vivian Davidson has undertaken this work in conjunction with Dundee, Perth and Kinross, both IJBs, Dundee City Council and Perth and Kinross Council, alongside NHS Tayside. Now, the aim was to achieve similar integration schemes, or one integration scheme was ideally the vision, to set that out across Tayside. Vivian started with inclusion and the creation of a Tayside-wide project team to oversee the work. Throughout this period, Vivian has worked tirelessly to try and promote and encourage a one overarching integration scheme. However, that has proved challenging, and I'll let Vivian go into the details there, but I'm pleased to say that both Angus Council and Dundee City Council, their schemes have been out for consultation. The paper that's in front of you today, I'll bring Sandy in once we've heard from Vivian, bring Sandy in with regard to the particular area about finance, just to clarify that, because I want you to be absolutely clear regarding the financial position and the addendum that was put out today. Vivian, can I hand over to yourself?
Thanks, Gail. It certainly has been a challenging journey to try and facilitate agreement across Tayside. What I would say is the main aim of completing some revisions was to try and make the document as accessible as we could, given the restrictions of some of the technical and legal jargon that we have had to still use. We've tried to provide many more definitions to support anyone who's reading the document. We've moved a number of paragraphs around so that it better clarifies the whole role of the Chief Officer, bringing them into one section rather than dotted all over the place. What we have tried to make sure is absolutely clear is who is responsible for what and when. The original 3 schemes were contradictory on that matter, and there was a lack of clarity for everyone involved. So it really has to be restated that the integration joint boards are responsible for strategic planning in relation to all community-based health and social care services for adults, services related to unplanned hospital admissions, and a limited number of arrangements in relation to child health. And where you are responsible for arrangements in relation to child health, they tend to be services that provide a birth to death arrangement, such as primary care, out of hours, and unplanned admissions through a accident and emergency. I think all IJBs have to, in their next iteration of their strategic plans, consider more strongly how they represent those limited number of child health arrangements. All services at operational level continue to be operationally managed by the NHS and each council under your direction. And the arrangements for community-based services, as you know, are that the Chief Officer takes responsibility for those services operationally as both a senior manager in the NHS and a senior manager in the local authority. So that Chief Officer role is complicated, having in a sense 3 bosses. So, you know, keep doing the job, Gail. What has been restated in the preamble to the integration schemes is the commitment of the councils and the NHS to deliver health and social care integration and progress the national wellbeing outcomes. I think the approach we've taken to the revisions has ensured that we've had really good, improved understanding from staff both in the councils and the NHS about the role and function of the IJB and the continued role and function of the council. So that has cleared a lot up. So much has stayed the same. There are, however, a few things that have changed. So, as I said, all sections recognising that the IJBs have been functioning for more than 5 years now, and therefore all references to the first 3 years of the IJBs have been removed. The clinical care and professional governance and risk sections have been updated based on the improved integration arrangements that have been developed over the past 5 years, and we have completely different arrangements for both of those things compared to what we did 6 years ago. Some paragraphs now better reflect the legal requirements of the legislation as our understanding about the legislation has grown, and that particularly relates to who is responsible and accountable in different situations. Following discussions about the potential for overspend in some IJBs, and I know Sandy will come on to talk to you about this, there has been an additional sentence added that may require an IJB to repay in following years any additional payments made to the council or the NHS to address an in-year overspend. And I won't go into any discussion about that because I know that's what Sandy wants to talk about. Further, following the Strang inquiry into adult mental health services in Tayside, the operational management arrangements for inpatient mental health services, inpatient learning disability and inpatient drug and alcohol services have been strengthened. The nature of the problems in facing those services meant that Scottish Government ministers felt there was a need for a senior officer who other than a chief officer, to have responsibility for that. So it was part of a parliamentary statement and subsequently a letter to NHS Tayside that those operational management arrangements had to change. So we have had to reflect those change arrangements in the integration scheme. Previously, those services were subject to a hosting or lead partner arrangement with Perth and Kinross Chief Officer responsible operationally for those services. What we do have to remember, it is a technical legal document. We've tried as much as we can to make it as simple as we can. That doesn't mean to say there's not still an opportunity to improve some of the English and make it a little bit more plainer. So we will continue to work on that over the next few weeks. But really what I would say is very little has changed. And the two things that are most important to recognise that have changed are about the potential for IJBs to have to make repayments and the change in operational arrangements for inpatient mental health services. So the consultation on the Dundee and Angus schemes ends on Sunday. If you wish to make comments, please do so. Thank you.
That's great. Thank you very much, Vivian. Sandy, did you want to come in at this point?
Yeah, thanks, Chair. Yeah, I thought it was probably helpful that I shared some detail about the financial implications of the change, the line that has been alluded to already. You know, it does have a financial implication for the IJB. I'm also conscious, of course, this is an agreement between NHS Tayside and Angus Council, but I thought it was important to share that. And I'm hopeful that the kind of simple way we've set that document out just allows anybody to kind of understand those implications. They're kind of not implications for now. They are implications for the future. You know, we as an IJB are here to make strategic decisions generally. You know, things that last into the future. And this is a document that's not being agreed by us, but it's a document that lasts into the future. So, you know, there will be implications or could be implications, but they're not here and now. They're in the future. But as I say, hopefully the document that we've shared allows people to understand those as best we can describe them.
That's great. Thanks very much. So we've got a few hands up. Councillor Bell.
Thank you, and thank you very much, Vivian and Sandy. Vivian, I don't underestimate the amount of work that's gone into this, and I know it's really hard working across all of these partners and peer groups. It is really tough. But my question really, and we had a really helpful briefing with Sandy last week as well, around that potential for underspend when we've got some intractable budget issues around large hospital set aside, complex care and mental health funding. And I mean, I'm speaking as the outgoing chair of the audit committee here, where, you know, these issues come up every time. And it does concern me that I guess that we'll always be the junior partner, if you like. But if we're looking at, you know, returning funds to a parent body when funds around those particular issues are still retained within that partner, then it's a real difficulty. And I just think we might need to get a bit more robust around the use of directions in order to facilitate that, because we've been I think supportive of officers having those negotiations, and we're also keen to become a bit more robust in managing them if that's required, if that's hindering the services that we want to deliver in terms of shifting the balance of care and closing the gap. So I guess I just wanted to highlight, you know, these are issues that come up at the audit committee all the time, as you will know, and to not underestimate the difficulties that arise. That being said, really good piece of work, Vivian. Thank you for presenting that today. Thanks.
Thanks for that, Councillor Bell. I think that's a very good point. I don't know if Vivian or Sandy want to respond to that.
Yes, if you don't mind, Chair. I think it's really important to understand that neither Angus Council nor the NHS are the parent body of the IJB. So I know
apologies for the terminology. I was just trying to put it in plain language terms, if you like, and totally failed there. Thanks.
Yeah, it's a challenging one because many people use that that term, but in fact the Integration Joint Board is a statutory public body in its own right, and therefore has an equal place to the council and the NHS, albeit that the arrangements for the funding are rather difficult and circuitous. You're quite right, Councillor Bell, that directions are very, very important, and an IJB should be considering whether a direction is required for every report it considers. There was new guidance on directions published by the Scottish Government during the pandemic, so it hasn't been an opportune time to implement that. However, I have drafted up, based on that new guidance, a new policy on directions, which is required by the guidance for the IJB to consider in a future meeting. I've yet to just consult with Gail on the content of that document. So yes, directions are very important for the governance of the whole arrangement. They clarify who is responsible for what, when, and why at a greater level of detail. And the level of detail in a direction is what governs the level of responsibility an Integration Joint Board takes operationally. So you could provide a direction that is broad in its position, or very detailed in what you require resource to be spent on. It also sets out the available resource for that particular course of action, and therefore requires operationally the NHS and the council to contain their spending within that resource. So in part helps address some of the issues about potential overspends.
Thanks for that, Vivian. That's very helpful. Peter.
Yeah, thanks, Chair. I'd just like to commend Vivian on a magnificent piece of work. I remember going through the original consultation way back in 2014, 2015, and that was a horrendous document and a horrendous consultation. This document here is much more readable, and I think the sort of before and after in Appendix 2 is particularly helpful. So well done, Vivian, on that. In terms of Sandy's briefing document, I found the word may in terms of repayment completely vague. There's no indication as to what would trigger that may to become an actual demand for repayment. Presumably it's when one or both of the partners would be in financial difficulty, which would imply that the IJB is in financial difficulty as well. Nor does it say when, if any, a repayment should be made, whether once the agreement has been made. So I think it's extraordinarily vague, and I think we should be very careful about how we judge that. Thanks.
Thanks for that, Peter. Sandy, do you want to come in on that point in terms of what Peter's made in terms of the vagueness of that?
Well, I mean, I've obviously highlighted it as a concern, and Peter's kind of picked it up. I think one of the reasons I particularly highlighted it is a vagueness that will have to be addressed at a period where we will be in a more challenging situation than we are in right now, maybe a more tense environment. So that I think is a worry. I mean, it's one thing for me to comment on it. Other people have obviously been largely party to the writing of this, and it's quite difficult to perhaps work out what an alternative phrase would be. But I think there is a worry about that and the vagueness, and the fact that when it's invoked, things will be probably more challenging than they are right now.
Okay, thanks for that. Andrew?
Well, thanks, Chair. Yet again, Vivian's contribution to this document and also to integration as well. I think Vivian has got an in-depth experience and expertise about integration and all of its implications. It'll be a hard act to follow for whoever takes that role on. Anyway, specifically, I have a question to Vivian, and my understanding was that this latest integration scheme was partly an effort to rationalise and align processes and strategies across the three IJBs and NHS Tayside in order that it could kind of work more smoothly and we're all singing off the same hymn sheet, as it were. My question is the fact that Perth and Kinross is not included in the consultation, is that work in progress that's going to be followed on later on, or is there are there some issues why, or some, you know, some kind of timeline issues in getting all three IGBs aligned to the same consultation? And will that have any effect on Angus operations?
That's a difficult question to answer, to be honest. There are some challenges with Perth and Kinross Council in their agreement to one or two items which the other two councils and NHS Tayside have all signed up for. The dialogue is ongoing with Perth and Kinross to try and address the issues. Some of them will be resolved rather simply, I think, by just changing some of the language. Not everybody writes in the same style, and the way I might and other members of the project group might have written something doesn't suit, you know, perhaps the legal chief in Perth and Kinross. So we will address that going forward. The main concern from Perth and Kinross is about strategic leadership in relation to inpatient mental health services, for which they previously had a lead arrangement. I think there's a very simple solution to that, where we wouldn't disagree that there may need to be some collaboration around the leadership of future plans for inpatient mental health, and it's merely an agreement really between the three chief officers about which one might take a bit of a lead role on that. But Perth and Kinross want that reflected in the plan. So I'm confident we can deal with that rather simply as well.
Thanks, Vivian. And Peter?
Well, thank you, Emma Jane. I was going to echo the point that Peter made and Sandy commented on about the uncertainty around the financial items. And that uncertainty will affect the accounting treatment. You know, if you've received money and it may or may not be repayable, how do you account for it? And of course, I think Sandy said we could nod this through now, but it'll come back to bite us only when it really matters, which is when tensions are high. So we need to get it now, even get it right now, even if we're in calm waters now.
Absolutely, that's a good point. Thanks, Peter. And Councillor Miles?
Yes, I'd like to just refer to the same point the two Peters have raised, but in contrast to their assessment of it, I like the vagueness of the word may, because it allows us in future times to decide, are we in a position to pay back or we're not in a position to pay back. And I'm not an accountant, and I can see how the accountants like it neat, but it does leave us this flexibility that will often be quite valuable to have this flexibility. So I'd like to keep it in there, and in future times when we have to come to make the decision, do we pay the money back or do we not, we can then assess the affordability of doing so at that time, rather than being tied into either paying back or keeping if the circumstances allow. So I'd quite like to keep that vagueness if at all possible.
Okay, thanks very much for that. And Elaine?
Yeah, thank you. I mean, this is a huge piece of work, but I wonder if there's almost an opportunity to take a step back and look and see if, almost reflecting on where we had planned for the delegation of authority, and I'm just thinking specifically about part 3, where the NHS Tayside services were delegated to, reflecting too on the communication we've had about Perth and Kinross and mental health services and how that was then adjusted. And really just a question for Vivian and the team, is there that opportunity to almost have a a wider angle review if where we have things delegated, is that still the best fit? And is this still the best way of arranging our services? Recognising that a lot of the delegation of things like accident and emergency, respiratory services, reflecting how in COVID this was very much driven from the centre, and a question really, is there a national thought to look at how the actual envisaging of the delegation of services has panned out? So I suppose it's really just, are we certain we're still things are arranged the right way?
I think there's a number of points in there. The first is that in the underpinning legislation, the Public Bodies Joint Working Scotland Act, it is a series of legislative functions that are delegated to each IJB. And to help everybody's understanding of those, we have to reflect on what those functions mean in terms of the services that are established under those functions at the time of writing the integration scheme. Now, strategic plans are all about transformation. So the services that we reflect upon in the integration scheme may not be the services that exist in 5 or 6 years' time. We have tried to increase the flexibility around particularly the Part 3 services and where their management should be by saying, you know, these might change subject to agreement by all the parties, i.e. they might move around management. For us in particular, the interesting one is probably around custody nursing and forensic and medical services, which might be better sitting in Perth and Kinross alongside prisoner healthcare. We've had some conversations about that, but haven't quite achieved it. So I think that might happen at some point in the future. There is no plans nationally, I'm saying at the moment, to change the functions that are delegated to integration joint boards. However, you will know that the Scottish Government are working on plans around the National Care Service. It is highly likely that what emerges from that work may, you know, will be a different shape for integration joint boards in the future. That was part of the consultation, and may in fact may change the functions that are delegated at that time. We certainly know that the Scottish Government are looking at delegating functions around more broadly around children and criminal justice services, for example. And in the National Care Service consultation document, there was actually no mention of inpatient services. So, you know, I can't say what's going to happen in 5 years' time when that consultation becomes something that has to be delivered. You're likely to see some indication in June when the Scottish Government expect to publish the bill. So we may know more by then, or you may know more by then. I won't be here.
Okay, thanks very much for that, Vivian. Elaine, are you happy with that?
Yes, I did have. Yeah, no, it was actually one other secondary point. That was really helpful, and I think you're absolutely right. The National Care Service. It'll be interesting to see how that plans out, and I think this will have a major impact. My reflection was on the next section down, was about the great list of legislation, and just reflecting that some of this dates from 1968, and just also being aware that for this huge list of documents and sections and numbers, some of them are particular, not bones of contention, but areas that often bring a lot of debate and concern. And it's very difficult to put a 1968 Act into practice, but often this comes down to decision making about and with people. And I'm just, I see Gillian Galloway's name there, is that we had spoken sometimes about guardianship and sometimes how this often falls to teams who are unfamiliar with it, and whether there's an opportunity, and it's really just an open ask of the IJB, to perhaps share learning across the IJBs nationally, sometimes about this very arcane, remote legislation to clinicians that can have quite profound effects on how we deliver services for people. And it's maybe an optimistic hope that with revision and also perhaps with the National Care Service, we may be able to get some national shared understanding, because often it comes down to meetings of people who are unaware of it, and it almost feels that we reinvent the wheel every single time with angst and delay and concern and fear. So it's really just whether there would be an opportunity to even pick off one or two areas per year, perhaps in our work plan, to work across the IJBs for education, for information sharing, for learning about complex cases. And it's a very ill-formed point, but it's something that came into focus for me, just seeing that huge list of acts that are thousands of pages of documents. Could we do this better?
Well, the first thing is, you know, it's up to the people who draw up the legislation to consolidate legislation, and that takes a lot of time and effort. I'm confident George will want to come in here. What I would say is the 1968 Act, I suspect you think about the Social Work Scotland Act, is not an arcane piece of legislation to people who've worked in social work all their life. It is an active and live piece of legislation that everyone is delivering every day. There are lots of opportunity and have been for a very long time about shared learning on these legislations across Scotland. The challenge, I think, is around the shared learning through integration. So there is a national organisation called Health and Social Care Scotland that supports chief officers and strategic planning and performance practitioners to work across Scotland on some of those contentious and challenging issues. Social Work Scotland also does that, but perhaps as a health and social care partnership, we need to work more to share some of the social work learning to health colleagues and some of the health learning to social work colleagues. It's much more at that level, in my opinion, but I'm sure George will probably have a view.
George, did you want to come in?
Yes, thanks, Chair. The Work Scotland Act 1968 gives us our powers to intervene, Elaine. Without that, we can't do anything. So it specifies our duties and our powers to intervene on behalf of the public in Angus. It has been updated and amended quite a few times, you know, quite recently as well for some of the amendments. And if you go online and check it, you can see all of those. So it hasn't stood still, but it is still a pretty important piece of legislation, albeit it is old. Worth mentioning, actually, this morning, Eunice Mclennan and I were talking about the application of 13ZA, Elaine, which might be one of the things you're referring to. We did have a session for all the people involved in that, probably back in about 16 or 17. We were just thinking it would be a good idea to revisit that and have another session around that piece of legislation, because you're right, it does. You know, there is so much legislation covering the social work side of the partnership that, and people who come from that background, that's usually their starting point. That what does the law say we can and must do, but there's not always a shared understanding of that across the partnerships. And the more opportunities we have to try and address that, the better. I agree.
Okay.
I suspect I'm one of the few non-social workers who's read Section 13ZA, but it often comes down to some very complex cases in hospital, and I think it is that shared understanding. There's a huge lot that we could do. You know, I'm sure that teams would give us a huge benefit, and I wonder if we should really think about perhaps working with you know, our acute areas to do it. I think it would be a huge benefit to people and their families. Yeah, I would wholeheartedly support it.
Okay, Thanks very much for that, Elaine, and thanks, George. Do we have any other comments on the paper? Comments or questions? No. Well, if we just move to the recommendations, which is firstly to note the draft revised integration scheme, and note that a report on the consultation and impact on the draft scheme is proposed to be brought back to NHS Tayside Board and the Angus Council Policy and Resources Committee in June for final approval of the scheme before submission to Scottish ministers. So are we happy with those recommendations?
Noted.
Yep. Okay, thank you very much for that one, and thanks again to Vivian. So we move on to agenda item 6, which is the annual work plan April 2022 to March 2023. Sandy, is this your one? No, sorry, I just saw your name at the bottom of it, so I'm not sure who's taking us through this one.
Imogen, I'll do it, but actually the report is self-explanatory. We've attached an appendix for everybody so you can see the proposed annual work plan for the IJB, and that that's intended to reflect our future meeting agendas, which comes back to our early conversation that we had today about planning for our agendas and managing them. So this is another thing that we're having to try and do to limit our agenda so that it's manageable for all of you within timescale. So hopefully you'll all agree that this is a more ideal way of moving forward, and this is a helpful plan there.
Absolutely, I think it's very helpful. It's actually, I find it very helpful to for the senior officers in charge of each section that it's highlighted as well. I find that very, very useful. Elaine?
I think it's really helpful, and I think I've been doing some work with the Area Clinical Forum and trying to align the work of the board with the Area Clinical Forum. And I think when it is actually written down, it's really helpful to know when it becomes a two-way process rather than being on the back foot. My one thought is are we assured that the timings are right? And I'm just thinking specifically about some of the annual reporting of things like professional governance, and just wondering is that fast enough and frequent enough to be reactive? And it's really just I suppose a point of curiosity and challenge is, are we assured that we would be able to pick up live issues quickly enough with annual reporting, annual, but really just a question. Would we need staging reports or interim reports, or are we assured that we're actually able to pick up issues quickly enough rather than to be 1 year behind? I suppose it's just it's coming from a point of curiosity, that are we assured that our timing is right?
Yeah, I'll bring in others here, Elaine, but there's obviously other committees and other forums where all the operational aspects get discussed. So it's been clear about the IJB's role and that strategic role rather than the operational role. Alison Clement chairs our Angus Clinical Care and Professional Governance Forum. So I would get my assurance from Alison, from the reports and from all the minutes there, and that will be reported. There's a number of hands up here, Emma Jane, so I'm not sure if they're going to come out yet.
I don't know if Sandy, did you want to come in on the point that Elaine just made?
Thanks, Chair. And actually, sorry, when you did first introduce the item, sorry, I am familiar with the report. Of course, I am. Sorry, I suggested it wasn't. Yeah, Elaine, that's a good question. Some of the timings on there are synchronised with other things that are going on. For example, some of the reports that come through in April and June. The governance one is one of those that tied in with year-end reassurance processes. Excuse me. That, for example, our auditors would look at. So there's one or two things that are there timed to do specific things. We have actually had one of these work plans a year or so ago. So a lot of the cycles we're already working to. A good example, just to pick one out, would be things like to pick a couple out would be things like our workforce plans and our communication and engagement plans. They've come through at some point in 21, and we followed them on for a year later. So they're all, a lot of the thinking has all been kind of scheduled. But what I would say to Elaine is, in terms of the reactiveness of them, this is just the plan. Obviously, we can absolutely have the right to deviate from a plan, and if we needed to react to any circumstance, that's completely okay. So this is not a definitive, it is just a plan.
Okay, thanks, Sandy. Councillor Bell?
Thank you very much, Chair, and thanks for this plan. We were looking at audit plans this morning, obviously at audit committee, and I guess one of the wild cards in that is the capacity of everyone involved in delivering those plans. And this isn't on the agenda specifically, but I just wanted to reflect that when you are coming out of a crisis that we've just been through, still dealing with, that tends to be the time when people start to struggle with volume of work or their own resilience once that kind of adrenaline fueled period is past. And just happy to hear what Sandy was saying, that we can flex that plan because there will be competing priorities as always, but we've got that extra level of complexity, and I'd remain concerned about people's capacity given what everyone has been dealing with, and I just wanted people to be mindful of that. I'm sure you are. So I guess there's that, striking that balance between governance and support of the officers in terms of not due to the volume of work. But that plan looked really helpful as something to work to, but let's not forget that there's always something else that gets piled on top. That was just my hopefully helpful contribution, that it is, we need to be flexible.
I think that's a good reminder. Thank you for that. Andrew?
Yeah, thanks. I just noticed that the annual review of the integration scheme has got as required on it. Clearly that's something that's long term, and we don't need to report on it that frequently. But I think it's important, and specifically from the fact that Vivian's no longer going to be doing that one. So I think we need to maybe at least have one review to pick up who's actually taking that work on, just so that it doesn't fall down a crack somewhere. That's just my impression from that line entry there.
Thanks for that, Andrew. Gail, can you respond to that in terms of responsibility regarding the review of the integration scheme and frequency as well?
Yes, we don't have another timeline unless Vivian's aware of another timeline. And has that been agreed, Vivian, across with partners? Because we didn't have a date.
There is a statutory requirement to the review of the integration scheme. So the next one after this would be 2027. It's a 5-year review.
5 years, yeah.
Every 5 years it must be reviewed. I suspect actually things will have moved on then, and we're looking at new arrangements coming out of the National Care Service, which is why it was really important to get this one as right as we could.
Yeah.
The work will be finished before I go.
Yeah. Vivian has agreed to support this piece of work until she goes, Andrew.
Mm-hmm. And in that case, do we need that line entry in there?
No, probably not. Probably not.
You may want to consider whether the new scheme is working better for you. Just reflections in perhaps 12 months' time to see if it's functioning better, and it may help you think about any consultation responses you might want to put back in future around the National Care Service.
Okay. I'll leave that to George.
Okay, thanks for that, Andrew. Any other comments on the work plan? No. So it's here for us to note anyway. So are we all happy to note this? Thank you. So we'll move on. We've got the two finance papers now, and I will take both the finance papers, and then I propose we'll take a 5-minute comfort break after those. Thanks, Sandy.
Yeah, thanks, Chair. I'll keep the first one certainly relatively brief. It's a position. One of the ironic things is we're presenting this after the year end is concluded, but it's not a year end report because we're always reporting slightly retrospectively, partly because of the way finance information flows through, but just because of the length of time it takes to put together particularly a year end position. And when we go into the last month or two of the year, particularly in an environment where there's lots of funding adjustments happening because of COVID and because of changes happening with the Scottish Government funding, we do sometimes see our financial position move a bit. So expect a change between now, what we said now, and what we might say in a final year-end report that will come to the next IJB. I think at this stage of the year, Chair, it's always important to look at a wee paragraph I've got in section 2 of the report. We present what we in our professional body would call management accounting information for everybody, and that's what the reports, the management finance reports. Separately, we will produce our financial accounts that will go through the audit committee. There is a difference between the two, and it's often to do with the movement on reserves and things like that. But it's important that you will hear different language used in the papers that we report here and what we see in our formal annual accounts. So it's just worth noting that. A couple of points to note in the report. At section 3.12, which I think is on page 125, I'll just let you get to that page. That section is about the impact of COVID on our financial position, and at the moment we are largely containing the cost of COVID, and that is a helpful thing. But it's also a reflection of where we are with some of our core service provision and the fact things have been redeployed. But it's worth just noting the final paragraph of that section. We have received a significant extra resources from the Scottish Government in February of this year, quite a significant amount, or a very significant amount, about just short of £12 million of COVID-related funding. Some important caveats associated with that money. They full well know it's intended not for particular use or employment in this year, but it will be carried forward through IJB reserves for use in a future year. So that's quite an important figure to note, and it has a significant effect on the reserves that we would see later on in the report. The other section I'd just like to kind of highlight, because it has an impact on the next report, is section 3.13, particularly the table on page 126, and just to highlight across the third bottom line, we know this is not a new phenomena, but we are only delivering a part of the recurring savings targets that we were intending to. Now, we have delivered plenty of non-recurring savings or underspends, but this is about our kind of planned interventions, and we are only delivering a part of those, and that is features in our strategic planning, financial planning in the next paper. The final thing I'd like to highlight, Chair, is actually in Appendix 3. That must be about page 130. Within Appendix 3, we describe 3 proposals that are collectively come together regarding to create a recommendation regarding our reserves. They are noting that we will, in all likelihood, have an underspend at the end of this year, and it's talking about using that underspend to adjust our contingency reserve, to also create a property reserve. And the idea of that property reserve is to allow us to support some property and accommodation commitments at some point in the near future, when, and I'm not talking about this year, the year to come particularly, but at some point in the near future, when we start to have more of a pinch point in our financial plan, our overall financial plan, we're looking at being able to release resources or to create a reserve that will support a change in our property situation at a time when we have a more of a tightening of our financial position. So that's what that's intended to do. I think this has been discussed at the strategic planning group and broad support at that group and through the management team meetings as well. It's important to note that just because we've created a reserve doesn't mean we can't go and revisit it, which one of the lines below that kind of highlights that point. But I think that's something that allows us to deploy our reserves to help deliver an improved financial position at the time when that is required, which at the moment in our plans is about 2 and a bit years from now. And the final part of that recommendation just notes that you know, we might have the potential where we might want at some point in the future to consider returning some reserves to our partners if we don't have a perfect way of deploying them optimally and bearing in mind the financial situations of our partners. Again, that would be dependent on prevailing circumstances. Time we made that judgment, which would be some point further down the line. So, Chair, that's the main points I'd like to highlight, and I'd say those bits of information on that section of the reserves are the main things that trigger a recommendation, one of the recommendations on the front page.
Okay, thanks very much for that, Sandy. We've got questions for Sandy. Andrew? No, it was legacy hand.
Sorry, legacy hand.
It's okay. Councillor Bell.
Thanks, Sandy. Obviously, really welcome that almost £12 million from the Scottish Government. I just wanted to pick up on page 131, the number 3 there. Pleased to hear you reiterate that caveat around potential return of some reserves. I'd, you know, pulling back to what I've just said, I'd be really reluctant to see us returning some reserves to our partners when we're still dealing with unresolved issues around large hospital set aside, complex care and the mental health strategy. So I really hope that potential doesn't turn into a definite, if you like. I fully appreciate it's maybe different pots, but I think the nature of that partnership needs to be built on trust, and it would be good to see some movement on some of those issues before we were in a position to do that.
Thanks for that, Councillor Bell. Sandy, do you want to respond to that?
Yeah, thanks, Chair. Just briefly, thanks, Councillor Bell. Yeah, this is a potential discussion at some point in the future. It's not something that we're going to be coming back to in the next 2 or 3 months. I think if we were going to come back to it, we'd let the dust settle on this financial year. We'd be well into next year, see where we are. It's kind of conversation we might come back to after the summer. You have noted down there about the prevailing circumstances. You've highlighted a few points that are a wee bit up in the air at the moment. But I did also allude to in the financial implications about the integration scheme, how that might change some of our goalposts for us a wee bit, not necessarily in what we choose to do, but maybe in how we choose to do something. So we absolutely can keep all this, and there's nothing predetermined. You know, it's very much just something for the future. It's kind of more of a marker, really. I think as an idea that we might come back.
Okay, thank you. And Peter?
Thank you, Emma Jane. Where we have an underspend due to unfilled vacancies, that's good news from a purely financial point of view, but might be bad news in the round, because you'd expect there to be collateral damage in terms of unmet need or stressed and overworked staff. What is the damage caused by unfilled vacancies?
Right, thanks. Thanks, Peter. Of course, clearly I'm not the best person to answer that, and somebody else might put their hand in a second in terms of answering that particular issue. We do monitor our unmet need, say, for example, the delivery of home care, something where we do have the stats for that, and George might want to comment on that in a second. He's certainly kind of described that in previous reports. So we know we are not managing to deliver all the care that we would choose to. And then that's in terms of a lot of that care is provided through the independent sector. We also know that we do have quite a lot of vacancies across our system as a whole, and they pop up in a number of different places. I'm not sure how quickly we'll be able to resolve them, but the impact will pretty much be felt in every single service. And I know in a very small way we've not had enough accountants throughout the year, and in a non-clinical way, in a non-service delivery way, it's impacted on various bits of financial management, including things like the governance arrangements that we discussed at the audit. It has an impact across the board, but maybe one of the head service might want to just give an example or two of the impact of unmet need.
George?
Yeah, I think, Peter, you captured it yourself probably in a couple of lines. It just, if we have too many vacancies, and we're not preserving vacancies just now, they usually occur because there's a time lag between somebody leaving and the replacement coming into post. So because the notice period is shorter than the recruitment period usually. The other thing is that we've been fortunate enough to be able to apply new money to some of our kind of core functions in the teams and increase the size of the team. So we're going through a lot of recruitment just now. Those are new posts, so we're just filling them, and that takes a wee bit of time. We've had quite a lot of retirements. I think, as Julie mentioned earlier, I think COVID's had a pretty big impact on folk who maybe were getting towards retirement age anyway, and that's nudged people out the door, I think. So there's quite a lot of that around just now. And sometimes we get good notice on those and sometimes less so. But the impact, I would say, is on staff and on service users or patients. There's less capacity across the teams and across the system, and that has an impact on direct care for service users. And the impact on the staff when the teams are shorter, they're working in a much more frantic environment and it's much more stressful. And I think the first line managers, of course, shoulder a lot of that as they rejuggle priorities all the time. So it's that becomes a pretty frenetic environment. I know when I was in that role years ago, the toughest time I can recall was when I was short of staff in my team, and that rumbled on for a few months and it was pretty hard going. So yeah, it has a positive spin-off in that you save some money that you can use for other things, but it's not a desirable place to be, and it's something we try to avoid. So.
I worry that we're in a downward spiral of, fewer staff leads to more pressure, leads to staff exhaustion, leads to staff leaving, which adds then to the pressure in the system, and it seems to be a downward spiral. So another question I would have on the finance front is, we refer to these savings or these underspends as non-recurring savings, but they seem to be depressingly repeating. More of an observation.
Sandy?
Yeah, Pete, you're right. I mean, just first of all, I hope in these reports we don't actually refer to these underspends because of vacancies and unmet need is a good thing, but I know that on a financial thing they kind of create an underspend, which has historically been treated as a good thing. But we do know that the underspends mean we haven't delivered the services we met. There's a direct link between vacancies and we have seen this for some time in the IGB, but of course a lot of that some time has been during this period where we've been also trying to deal with COVID. I do not know, and I don't think any of us really know exactly how long-standing the issues we have, the complexities we have in terms of recruitment challenges will be. We're always looking at ways to kind of, for example, work with the independent sector to encourage and develop that workforce. The tools we have, I suppose, to some extent have been they may be quite hard to lever right now when we are still in a COVID, kind of a response, and maybe as we gradually come out of that. And maybe the economy and the workforce availability normalises a wee bit, we'll see a new landscape. But whether that will be a lot better than what we have right now or not, I mean, I just don't think we know. So I think there's a lot of uncertainty out there in terms of the workforce availability and then how it reappears in the finance system. And we might have to look at slightly different ways, and that would hopefully come through the overall workforce plan.
Okay. Thank you.
Thanks. Okay, we've got quite a few hands up, so I'm just going to take them as they appear in terms of when they first went up. So Alison?
So my point was very similar to Sandy's. I have concerns that with COVID, the arrangements that were put in place where things were centralised into this command and control environment, it was necessary to cope with the unscheduled care demand. But now moving forwards, we really need to be progressing the more scheduled, routine, preventative aspect of care, and that is very much linking with the planned care board of NHS Tayside and our partnership with Angus Alive, and really get into the prevention. So there's a big, huge part of our strategic plan and services that we should be delivering within the community to prevent the reliance on the hospital hospital system. So I'd be very concerned about having a model of care that felt that we didn't have to rely on so much resource within the community, because all of these issues that you're bringing up around the workforce, the need to grow the third relationships with the third sector, alternatives to reliance on highly qualified professionals when another role would support, and I bring in the peer support workers across every general practice that are hugely successful and that we would need to build on if we're going to have sustainable work in the future. And I'm thinking our social care officers and all these valued people in the community. So we have had a bit of a delay in being able to progress that work because of COVID. We've got a whole load of people who are deconditioned and we've got a lot of catch up to do. So yes, we don't have the workforce to continue to provide the model for even more people, but we also need to ensure that we've got the resources available, because it is the only way, from my perspective, to build up the multidisciplinary teams and their resilience and alternatives to becoming unwell, then getting help in a hospital. So for me, it's how do we think strategically? How do we have our risks in the right place? And we do have well described workforce risks that we need to build on, and according to all our other risks, a strategic plan for the next wee while needs to address that. So that would be my concern about not thinking of what the reserves and the spend that's going to look like in the future. Thank you.
Thanks very much for that, Alison. And Jill?
Thank you, Chair. It was just to build on what George was speaking about, and from a workforce perspective, and I think just to acknowledge, as a partnership, we've actually been as proactive as possible. So we've over-recruited in a number of areas during COVID as well to support the staff. So we have, on an ongoing basis, looked at the needs of the service and what it is that we actually need to deliver that service in terms of workforce, and put some additional investment before all of the Scottish Government monies came to support that on a longer term basis. So we have, where possible, taken a proactive approach around supporting that, and just to give assurance that when vacancies do arise, that we review the skill mix within the team. So picking up on what Alison was saying, is it the right person to do that role, or is there another way of doing it? So we do that on an ongoing basis as well. So it was just to give a couple of points around that, Chair. Thank you.
Thanks very much, Jill. That's helpful. Chris?
Yeah, thanks. Just to pick up on, sort of Pete's initial comment, what's the collateral? What's the effect of a shortage of staff? And I've spoken on this before at the IJB and in other forums that, as far as the local authority is concerned, the terms and conditions are relatively good. Can always be improved on, of course, but they're relatively good compared to the independent sector that struggles to recruit and retain staff. And we've spoken about this before, and we can talk about the amount of money that can be put in to try and address that issue. But the fundamental problem is about filling those unfilled vacancies out with the local authority. Is how attractive those jobs actually are. They're low paid. The terms and conditions aren't as good as working in the local authority. There's no access to things like statutory sick pay, for example. Now, that's something that we're working on, to be fair, with the authority in terms of Unison's ethical care charter. But, those unfilled vacancies won't magically get filled overnight out with the local authority, and perhaps the NHS too. I don't work for the NHS, so I can't really say that. But they're not going to get magically filled overnight unless the terms and conditions are made more attractive, that the work and the role of social care becomes a more attractive option to somebody than going and working somewhere else for a better amount of pay in the retail sector, for example, or in the entertainment sector. So they're the bigger issues. We've got to address that fundamental problem in recruiting people in those vacancies in the first place, rather than just kind of hoping. When we look at our resources as well and shortages of staff, and taking that pressure off the NHS, as I think one of my colleagues on the call on the meeting mentioned just a few minutes ago. We're looking at where those resources are, but we've actually just decided, the board has, to go ahead with the closure of a council-run care home. That was a resource that was available. Now, that was staffed with social care officers employed and others employed in many cases by the council. And we've certainly gone and lost that resource. So the collateral about vacancies is huge on the staff that remain in terms of longer hours, stress, burnout, etc. But it's part of a fundamental bigger picture about recruiting and retaining people to work in the social care sector. We need to make the job more attractive, and we can have plans and projects, but fundamentally it's about terms and conditions and how the job is sold and how the job's managed. Thanks.
Thanks, Chris. And Elaine?
Yeah, there's a lot been said. I think we all agree it feels very, very real. It's a saving. It's one that I think we hesitate to use the word saving because we know it comes at cost to individuals and across services. Unusually pessimistic from me, but we know as well that there's always an ebb as we come into the summer. Many of our professionally trained staff take up registration. Newly qualified practitioners all start now in September and October. So often for areas like nursing staff and allied health professionals and medical staff, we often see a reduction as we come up to that replenishment that now happens only once a year. And that's something we're now locked into, unfortunately. But it is very hard. And I think we are looking at significant trained nursing gaps every single shift now across our acute services. Staff are very tired. And I think some of that resilience and just recognising Councillor Bell, again, the recovery, there's some really good stuff here about that as we start to recover from our lowest emotional ebb, as we start to come back up, still below where we started before a disaster, that's often where teams fall apart. And I think we're all feeling that. And I think just to reinforce that, we know this, but we see it. But it's sometimes holding that faith that we can actually get through it. And by supporting the teams, it is part of the recovery process. It's known about. But really, the teams falling apart can be very difficult and feel very personal. So I think it is felt just by all of us and by our teams. And it's just doing every little bit that we can to hold them together.
Thanks for that, Elaine. Do we have any other comments or questions on this paper? No. So we just move to the recommendations. I'll not read them out. There's 4 recommendations at the start of the paper. Are we happy with all of those recommendations? Yep. Okay, thanks very much. Thanks very much, Sandy, and thanks to all the questions and contributions in that agenda item. We'll move on now to the next financial paper, which is number 8, the strategic financial plan. And I'll hand over to Sandy again. Thanks, Sandy.
Yeah, thanks, Chair. Firstly, just to kind of note, I am conscious with some of these reports, particularly financial planning ones, they have a number of recommendations, which I know then clutters up our action points. Sorry, I've just spotted Councillor Bell's got her hand up. Was that? Oh, yeah. No.
That's in anticipation of you finishing, Sandy.
Oh, right, okay, that's fine.
Just
right.
An early adopter on this one. Thanks. Okay.
Right, yeah, sorry, conscious that I have a number of recommendations. Some of them is because we haven't managed to do things in the past or we're not quite where we would like to be, and recommendations 1 and 3 are examples of that. And others recommendations just reflect the complexity and the kind of joined up nature of what we're trying to set out. This report itself is an update of the paper that we shared in February. It's got updates regarding some of the Scottish Government funding. I should at this point maybe note that at one point in section 4.2 I referred to some of the Scottish Government funding being to support the Chief Social Care Officer, and I should have written Chief Social Work Officer in that section, so apologies, that just needs refreshed at section 4.2. But the paper reflects some updates regarding Scottish Government funding, updates of some of our assumptions, and it also reflects the outcome of some decisions we made in February at the last IJB meeting. So just to highlight some areas, section 4.3 of the report, I'll let people just gradually get to that. 4.3 of the report highlights some of the unresolved issues, and it's helpful now just to link them back to things we've spoken about earlier on in the IJB, but they're flagged up quite clearly there. We have got some unresolved issues. Further on, section 5.2, worth highlighting this because it's quite a topical issue, but it's also a really important issue. We've had a number of years of relatively benign inflationary environments. We no longer have that, both, well, obviously in terms of things from our perspective regarding things like wage pressures, but also a number of our supply costs and some of the supply or non-pay costs that appear in some of our contracts. it's a dynamic environment. We are doing our best to respond to that as best we can with the resources available. And then section 5.8, which is a wee bit further down, that's on page 141, is worth noting because that is a recent addition reflecting the decisions made at the IGB meeting in February, where we agreed to set aside some of the resources we had available to us to support the prevention agenda. So the paper is very similar to the February one, but it has got new additions in it. I think then the last point I probably want to flag up is right towards the end, Chair, in section 13.1, where we kind of summarise the overall position. We highlight or set out that we feel we can probably cover our positions for this year that we're about to start and the year after, but overspends emerge from 24-25. That's very similar to what we said when we were putting the February draft together, but it's still the position right now. So that kind of sets out the overall position. I probably covered that and said that in previous papers. This plan, though, is obviously assumes a number of savings proposals are delivered this year. So we have to still deliver a number of proposals and planned interventions, and then we still have this residual overspend to address. So that's a landscape, hopefully, that would feel familiar to board members. It's not inconsistent with what we set out in February with one or two refinements to it. But yeah, happy to take any questions.
Okay, thanks very much, Sandy. And Councillor Bell was very quick on questions, so you can go up first.
Thank you very much, and I'm just eager. Something jumped out at me, Sandy, that I hadn't picked up on before. I'm not sure if we'd seen it before. On page 139 within section 4.3, it's item 4 around the NHS Tayside's financial plan, including an allocation for shifting the balance. If the IGB did not receive a share of this allocation, it's now assumed that the balance of this funding will no longer be available by NHS Tayside to IGBs. I was wondering if I could have more detail on that. I did look back to the relevant NHS Tayside paper, and it had £2 million set against shifting the balance of care within a total budget of 9.3 million as a baseline uplift to the IGBs. Is it only Angus IGB that's not receiving a share of that, or is it all of them? And I guess our share would be in the region of £650,000. And where was that assumption made? And is this the end of the road? Is there something that we can go back to or direct? Clearly, that would be having an impact on our services and hindering that shift in terms of balancing the care and closing the gap.
I can respond to that. Thanks, Councillor Bell. Yeah, this point was really included in the paper to kind of close the loop, really kind of draw a line under something. Maybe hasn't done that job perfectly, Councillor Bell, but that's what it was intended to do. This was funding that NHS Tayside had set aside in its own financial plan in 2021. Discussions at the time suggested that funding would support a shift in the balance of care eventually may result in resources supporting things within IGBs. There was never a definitive plan about how that resource would be allocated. Some of it has been allocated to other IGBs in Tayside, not to us, but more based on circumstances at the time. Some of it linked to things like large hospital set-asides and things like that, but we didn't receive any resources in terms of what was allocated. And I think ultimately, probably as they went into 21-22, that allocation was reabsorbed into NHS Tayside's own financial plan. So it wasn't a Scottish Government ring-fence allocation for a particular purpose. It was something NHS Tayside was creating in its own financial planning and subsequently reabsorbed into its plans. So yeah, we didn't receive any, and our assumption now is that in terms of closing the loop, that allocation would no longer be available to us. So that's why I've included it there. I haven't particularly included it from the perspective of following it up, but there we are.
Okay,
I'm not,
Okay.
well, I'm not delighted about that, no. So
No.
you can probably tell.
Yeah,
So the other IGB's got an allocation, but
yeah, I can maybe follow that one up because I was closing the loop here. I can maybe follow that up with NHS Tayside's Director of Finance just to get the audit trail on that and the decision making behind that, because it is part of their overall plans. Their overall plans are quite wide, they're enormous. The plans are enormous. It is one line in that plan. So I'll follow that up and just see if I can see the decision making approvals behind that. Maybe I'll not leave it to the next meeting. I'll try and share some.
it does link into what Elaine and and Alison have been talking about in terms of that prevention agenda and moving activity away from the acute sector. So yeah, it's important. So that's very helpful, Sandy. Thanks.
Thanks very much for that, Councillor Bell, and for picking up on that one, and thank you, Sandy, as well, for following up on it. Peter?
Yeah, thanks, Emma-Jane. Referring to page 139, bullet point 4 about national insurance charges, I was under the impression that Scotland would be getting effectively a refund of those as a result of Barnett consequentials, and therefore, in theory, we should be getting some of that, if not all of that money back. Is that the case or not?
Okay, yeah, thanks, Peter. So I think what you're saying there is that this is portrayed as an additional cost to us, and we're saying, well, we have to. But the extra burden there is this kind of cost pressure, which is where it appears there. The money is contributed to the government, therefore we should get some of that back in the future year. The logic of that is exactly right, Peter. The social care levy, which is what it'll become from next year, it's just a national insurance increase. It will morph into something slightly different next year. Is designed to ensure kind of ring fence funds. I hadn't followed the national debate about it kind of coming back to Scotland in terms of a Barnett consequential, but that would be entirely logical if it did. It then becomes the question of how transparent or direct is the increase in national insurance allocations with the additional funding that we're receiving. Now, it is worth bearing in mind, in this paper, we do set out in this year already, we have received significant extra funds to support social care. So I'm not sure of the exact link, and I actually might follow that one up because it's probably interesting to understand. Is it a case even already that some of the additional funding that's come in for social care is being bankrolled effectively by the planned receipts from this? I'll follow that one up.
Yeah, I'm wondering if it's basically cost neutral, which would be good.
Well, okay, yeah. If it's cost neutral, the new money that they've given us for various things in terms of increasing social care funding has generally come with an associated obligation to do something. So not quite sure it'll be cost neutral. We have been funded for our health side of this burden because it's linked into all the pay funding that comes through on the health side. So there is a partial financial support for this.
Okay, thanks.
Okay, thanks, Peter. Do we have any other questions for Sandy before we move to the recommendations? No. Okay, so well, I trust you'll all have read through the recommendations. There's a number of them, as Sandy has intimated. Are we happy with all of the recommendations? Yep. Okay, that's great. Thank you very much indeed. So as I said, we'll have a short break just now. I think we're nearly on 3:45. So if we come back about 5 to 4, if that's okay, I'll have a quick break. We'll see you then.
John, can you pause the light?
Okay, thank you. Welcome everybody back. So we'll just continue on to where we were on the agenda. We were on agenda item 9, which is the COVID-19 remobilisation implementation plan update. And is it Jill that's doing this one?
Yeah, thank you, Chair.
Yes, Chair.
Thanks, Gail. So this is just an update on the Angus remobilisation implemented COVID. People be aware that at the start of the pandemic we had to develop a mobilisation plan, and then as we went through the pandemic that turned into a remobilisation plan in terms of getting back to business as usual. So this is our remobilisation plan 4, also referred to as RMP4 from a Scottish Government perspective, and that was completed last year for the year 21-22. As we're coming to the end of that year, and as we've reflected earlier on, although the transmission rates etc. are still high and COVID is very much still with us, we're very much moving into how we live with COVID and getting back to a bit more of business as usual, building on some of the learning that we've had from COVID. From a Scottish Government and national perspective, there isn't a requirement to do a further remobilisation plan for COVID, and we're moving into what we had done previously in terms of an annual delivery plan going forward. So this is just to kind of give an update of where we are in relation to the actions that we had included as part of our remobilisation for 21-22, and hopefully people will see the immense amount of work, and I know that you commented on that at the start, Chair, in terms of the work that had gone into it, but we have been able to complete a number of actions on the plan from a remobilisation plan perspective, and where we haven't, they're very much built into our plan for going forward and how we take that into our business as usual and link it in with the work that we have that's ongoing. So I'm not going to go through each individual action. I think just to reflect the work that has gone into the remobilisation, both from a service perspective and pulling the plan together, the sheer dedication and commitment from all of the staff within the partnership to get us to where we are, and I include Hayley and Nikki, obviously yourself now, but Ivan previously in that. I think as a partnership we've worked exceptionally well together, and also from an acute perspective we've worked very closely with acute colleagues to provide us safe and effective care as we can for the service users and patients, but also provide hopefully a safe environment for staff as well, noting the impact that the pandemic has had on staff. So happy to take any questions and hope that the IGB would support the recommendations.
That's great. Thanks very much for this paper, Jill. And absolutely, what struck me reading through was just the sheer amount of work that has happened and continues to happen. So absolutely reflect your words regarding that. I would also just like to highlight the risk section in this report. I found this really helpful, really well laid out as well. So thank you very much for that. I think it's very helpful to have it laid out in this way in the paper. So thank you. Any comments or questions? No. Okay, well, if we just move to the recommendations, which are noting the progress made in implementing the remobilisation actions during 21-22, to note the current national context in relation to remobilisation planning, and to approve the recommended partnership no longer maintain a separate COVID-19 remobilisation plan, but that the remaining priorities are reflected in the strategic and commissioning plans and individual service plans. So are we happy with those recommendations? Yep. Okay, thanks very much, and thank you very much, Jill. So we move on now to item 10 on our agenda, which is the Angus Mental Health and Wellbeing update, which we receive at each of our meetings. Handing over to you again for this one, thanks.
Great, thank you, Chair. So yeah, this is our full update in relation to mental health and wellbeing services within Angus. Again, I won't go through the paper in detail, on the assumption that people will have read the paper itself, but just a couple of things to pull out in relation to the funding that we've had in relation to mental health and wellbeing in primary care, which quite an extensive amount of funding, which will allow us to progress what we've detailed in the paper in relation to the rollout of the enhanced community support from a mental health perspective, which has been really successful and has also won an award, as we've said, and I think it's worth just noting that for the people involved. And also the Listen, Learn, Change Action Plan, and people will be aware the mental health oversight group that was established back at the end of last year. We've had a lot of different conversations and meetings with them in relation to our RAG status. So just to bring the board's attention to the fact that some of the RAG statuses have changed following discussion with the mental health oversight group. Going forward, they will publish their second report, which is due probably at the end of this month. We've had one report from them, and we're looking to build on that, and they've identified 5 areas that they're looking to take forward, and that's health and social integration, patient safety, workforce engagement and culture. So that's going to be the focus, and each of the recommendations have been put into one of those categories. So we've got regular meetings with the oversight group in relation to those categories. And I have to say, I know I reflected at the December and I think the February meeting as well, that things continue to work well. It does feel at times that progress is quite slow, but in some of the cases, we're doing a lot of that groundwork to really get solid foundations for progressing the work going forward, so that we're creating and developing really sustainable models of care and relationships, because it's the relationships that will make this truly work. We mentioned that we had the Living Life Well Angus implementation plan, and that we really wanted to develop that and co-produce that with the community and the population of Angus. So we have embarked on the engagement events and had a really successful few months around that. Got some of the responses there, and I'm just going to invite Sally, if she's here. I know she was jumping between meetings as well, just to talk about that. But it's been very well received, and as you can see, the priority areas and actions that we had identified have been supported by everybody that we have engaged with. So Sally, are you around?
Yeah, I am here, Jill. Thank you. Yep. So we had invited over 1,000 either individuals or organisations to spread the word, including the Angus Mental Health and Wellbeing Network, and it invited people to complete our online questionnaire. Or our development officer actually went to visit a number of organisations, so saw many people at one time and had one-to-one discussions. So their feedback has been included within the survey, and we'll give a more up-to-date and comprehensive summary of the feedback in our subsequent paper at the next IJB. But the number of people who've responded to the questionnaire has actually increased since the publication of this paper. It's 127 people, and actually when you amalgamate the number of service users and families and carers, it's 34% of people have what we call lived experience, either directly themselves or as a family member or a carer, and 40% of people who provided feedback were providers. So, as Jill said, a number of positive comments, but one of the things we need to work harder at is sharing our successes and sharing the work that we do in relation to mental health and well-being. People want to know, and they want a single place to go to know about that. And we're using a mental health awareness week that's coming up very soon to really start our awareness raising or augment our awareness raising. We do it, but we obviously don't do it well enough at the moment, and so we'll be looking to do that. And that's interesting that that's one of the areas of focus from the oversight group as well. So it was recognised that our plan is ambitious and rightly so, and that there were some concerns about how we're going to do it. But I tell you, we're working with some really enthusiastic and committed people to make a difference. They really believe in what they're doing, and we're supporting the Angus Voice Network to increase their reach. And so I hope that you'll be pleased with the amount and level of engagement that we have done and that we will continue to do. We did go to great lengths to produce alternative methods of engagement and provide phone numbers and easy read, but nobody actually asked for a specific copy of that, although it was accessible on our website. So I'll stop there and take any questions if required.
Thanks, Sally. Chair, is it okay if I just go through the rest of the paper and then take questions after that? I think just to reflect on one of the things that Sally said is that one of the parts of the feedback was that it is an ambitious plan, but I think that that's something within the partnership from an Angus perspective that we actually take pride in being ambitious, and sometimes we do have to make some brave and courageous choices around that to do what's right for the service users. So I think that that's quite a positive thing, and as long as we're monitoring progress and if there are areas that we feel that are too ambitious for us in the timescale that we've got to do them, then we'll obviously review that. The financial implications we've obviously touched on through Sandy's report, so I'll not go into that. And the risks remain the same as they have done previously. And Chair, just based on comments, we will look to do similar risk sections to what we had in the COVID paper for future papers coming to the IGB. So in Mulberry unit, again, we picked up on that at the start, and work is ongoing in relation to the delayed discharge as well. So I think we're in a good position still in Angus. We had a really good meeting with the oversight group, which I have mentioned in the paper, with colleagues from the Community Planning Partnership, and got really positive feedback from the oversight group just in relation to our partnership working with them. The other thing to note is just some of the principles that we will continue to work to around a whole family approach and no wrong door, which is really underpinning what we want to do, certainly within mental health and other services within the partnership as well. So I think that's it, and we are in a position to bring back the full plan in June for approval. So quite happy at that.
That's great. Thanks very much, Jill, and thanks very much, Sally, as well. You know, one of the questions I had was around the engagement work that had happened. It looked very impressive in terms of the figures, but it was good to hear your thoughts in terms of you felt it was a far-reaching engagement process. So that was useful to hear, and some of those percentages as well in terms of service users responding. Gail, I see your hand's up. Do you want to come in first before I bring in the others?
I think, as both Jill and Sally have said, it's extremely positive progress. And I think it is important to recognise that the Mental Health Oversight Group did indeed commend our progress when they came along to the Community Planning Partnership session. They wrote to Margot Williamson as the Chief Executive to actually particularly compliment us on that. The plan now for the oversight group is they're going to come to each of the IGBs and do site visits. So I'm in the process of planning that for early June at the moment, and they want to speak to our frontline teams to actually see what it is they're doing, go out and meet the team and see what it is they're doing. So I think it's really important that they get the opportunity to showcase the work that we're doing locally as well.
That's great. Thanks for that, Gail. Councillor Bell.
Thank you, and well done on such a positive report. I genuinely feel really heartened by it, and I guess that's the value of having that local control over so much of what we want to do in the community. I just wanted to reflect actually that some of the issues that we've had in Tayside and Angus around data gaps, for example, with Police Scotland. I had raised with Public Health Scotland because Police Scotland is one of our key national partners. And I was working on the principle that if Angus was experiencing those challenges, they would be happening elsewhere. So there were conversations at a national level, and I've heard from Frontline that those data gaps are being addressed, which is really helpful. And I think that's one of the benefits of having a national organisation like that, where they can bring about change at a local level. And it was great to hear feedback on the developments of the Dundee and Perth hubs, and that they were aware that Angus is kind of next on stream, if you like. So having those positives to discuss at a national level was actually really great, and it made me feel very proud of you all and the work that was doing. It has taken a while to get here, but congratulations. And you're absolutely right, Gillian, being able to develop services that our citizens deserve, absolutely important, and it has been a big turnaround, so well done. Thank you.
Thanks very much for that. Sarah?
Thank you, Chair, and thank you, Sally and Jill, for your really comprehensive report. My only suggestion is, as the Exec Armed Forces champion for NHS Tayside, I just wondered if we might make connections to the recently published Scottish Veterans Network Mental Health Action Plan and the Scottish Government established under the chair of Charles Winstanley to take forward that work, and also the provision of V1P services, obviously hosted in Dundee, but obviously available across Tayside, and just thought that might strengthen this, particularly in light of your comments around whole family approaches, because clearly it's not just the veterans themselves, it's their wider family members as well that may be affected by the mental health. Thanks, Jill.
Jill, did you want to come back in on that one?
Yeah, if I can, Chair, and thank you, Sarah, for that suggestion. I think just to give some assurance, and I think it demonstrates the value of the engagement. So veterans came through loud and clear through a number of our engagement sessions that we have had. So we have touched base with colleagues in Dundee, Sarah, and I think just we'll pick that up in the next one and see how we can pull that out, just to give assurance that veterans absolutely are included in this plan. And now that the plan that you refer to is being published, then we can link that up with our introduction to say that it has been taken into account, and that we will make sure that the links are there. So thanks for that, Sarah.
No, thanks very much, Jill. Thank you.
Hayley?
Thanks, Chair, and thanks, Gillian and Sally. Yeah, it was more of just a comment, to be honest. Sally, you mentioned the Mental Health and Wellbeing Awareness Week, and I think what's really positive about this one is that we're doing this as a full partnership approach. So it's with third sector, community planning and health and social care partnership. And I think what that allows us the opportunity is, I think, Sally, you said earlier, we're not very good at shouting about what we do. I don't think any of us are very good at that, and we do an awful lot in Angus. So I'm taking this opportunity over the Mental Health Week to really raise the bar on what it is that we're doing in Angus as a partnership, and how then we can build on that with opportunities through the third sector and other partners around the table. So yeah, I feel that's a huge gap that we need to fill, and I think we're on our way doing it. I was also part of the focus group that Gail was talking about in regards to the oversight group, and again, just found that a really, really positive experience. I think they were, I don't want to say the word shocked, but I think they were highly impressed about some of the work that had been going on in Angus, and I think we all should be really impressed by that, because we have been working our socks off, so to speak, to make sure that we're doing the best that we possibly can. And I think without the partnerships that we have, I don't think it would be possible. So yeah, really looking forward to Mental Health Awareness Week and looking at what the third sector can also bring into that. When I say third sector, I mean obviously the wider third sector, not just ourselves. So yeah, really positive way forward.
That's great, thanks Hayley. And yes, myself and Councillor Miles have also met with the Mental Health Oversight Group, and they were particularly complimentary about the partnership working that happens in Angus across all the sectors, the third sector, the HSCP. You're probably right, quite surprised about the level of depth of those partnerships as well, so that was really good to hear. Any other comments or questions on this paper before we move to the recommendations? No. Okay, so the recommendations are all listed. There's maybe 6 at the start of the paper, and just the final one there, just to highlight, is that the implementation plan will be brought to the June or next IJB meeting. Are we all happy with those recommendations? Yep.
Agreed.
Okay, thank you very much. Thanks everybody. So we'll move now. So item 11 on the agenda is an agenda note, is the primary care update on premises. So you'll all have had a chance to read that briefing note. I don't know if there's any questions, comments on that, just for information. And then we move to item 12, which is the date of the next meeting. I'm actually going to bring in Gail. Oh, sorry, I've got a hand up. I can't see whose it is. No, there wasn't a hand up. Oh, there was. Councillor Miles.
Yeah, I'll wait and get Gail's comment. I'll make a comment after.
Okay, that's fine. Gail, can I just bring you in at this point whenever we get to the date of the next meeting? So our next meeting is Wednesday, the 22nd of June at 2 o'clock. But Gail, I know you wanted to come in at this point.
Yeah, I've just spoken to Karen, Imogen. It may be necessary for us to have a special IGB before then about some of the other outstanding issues, so I'll keep you informed.
Okay, so soon we'll hear from Karen or yourself directly in terms of a meeting before that 22nd of June. Okay, thanks for that. And Councillor Miles.
Yes, thank you, Chair. I thought this was to be my last meeting, but if Gail indicates there may be something else coming on, we'll wait and see. But as was indicated at the start, this will be my last full board meeting, and I just want to thank you all, especially the officers and staff, for making it such a pleasant experience, and for all the really hard work you have done in unprecedented times. It's amazing how the difficulties bring out the best in people, and that's what I feel has happened in Angus. It's brought out the best in the staff and officers we have, and it has been shown and recognised at the highest level in Scottish Government how Angus is leading the way in finding a way through this difficult pandemic and other issues that are facing us. So it's probably heartily I can leave then very confident that I'm leaving the IJB in very, very good hands. Obviously the councillors themselves have to wait and see what happens after the election, whether some of them will be back or not. But I feel that the group we have, and pay tribute to all the outside body representatives, they have been very constructive and very let's say complimentary, and complimentary being working with us rather than the other way around, although I'd like to compliment that as well. Working with us so well to achieve these outcomes, and always very constructive in the comments they make, and it's been very welcome again to work with these group of people. So I will happily leave in good hands, and congratulations to the chair, Emma. You've done a great job, and continue the good work done by Lewis and Hugh. What I really liked was you were able to achieve consensus most of the time. We have had a couple of votes, but most of the time I feel consensus is the way forward, and we can all agree that what's the best way forward. I never like votes in any sort of format like this, because there's always putting one side against the other, and I think at the end of the day we want what is best for Angus, what's best for the people we represent. So well done you in achieving that. So all the very best to you all, and all the best to Vivian too. She like me is taking leave, but I'm sure she'll find something else to take up her time, and we may not see the last of her yet. At some point we might meet in the future. So all the best to you all. Thanks.
Thanks very much, Bob. That's lovely words. Thank you.
Thank you, Bob.
And I think we'll all miss your updates on the farming situation in Angus as well. Absolutely. I don't know if anybody else will be able to keep us up to date with the current farming situation, but so we'll certainly miss those as well.
Well,
okay,
as long as the weather keeps good, it'll be a good report.
Yeah. Well, that brings us to the end of our meeting today. Thank you very much, everybody, and we'll see you again soon. Thank you.